So I'm Kay Domkowski. I'm an optometrist here in the Bay Area, and when I was asked to speak to the group here, I was really excited about discussing the vision symptoms in Parkinson's and how it impacts the eyes, because I think oftentimes the motor symptoms of Parkinson's overshadow the ocular symptoms, and yet the ocular symptoms can be really frustrating for the patient. So I think a lot of education is needed to let you know what to expect with your eyes and some things you can do to improve some of your symptoms. And I also think that this is a topic that really touches a lot of people. I know personally I've had family members, actually my husband's grandfather had Parkinson's disease, and it's something where I think that when we discuss all the different options and the different consequences of the disease, it's really helpful and beneficial for all of you to try and make a difference. As you all know, Parkinson's disease is a progressive degenerative disorder of the central nervous system. It's caused by death of the dopamine-containing cells in the substantia nigra region of the midbrain. And we don't know the cause of the cell death, but we know that the result of the cell death causes a loss of the ability of the patient to execute smooth, controlled movements. And we know that there are 3 hallmark symptoms typically of Parkinson's disease. And the first symptom is tremor. Tremor is the most apparent and well-known clinical symptom. About 30% of patients who present with Parkinson's disease do not present with tremor, however. And the tremor tends to be worse when the patient is resting. So it tends to improve when the patient's actually voluntarily moving or actually sleeping. So the second symptom of Parkinson's disease is rigidity, and that's classified by consistent muscle tone contraction. And when the muscles contract like this, it tends to cause stiffness. That stiffness can lead to joint pain. That often can be an initial symptom of Parkinson's disease. And as the disease progresses, these symptoms do tend to progress also, and in time the eyes can be impacted. So I want to touch on that in a few moments about how that would occur. The other symptom that you all know about is bradykinesia, slow movement, or akinesia, no movement. And this is the most characteristic clinical feature of Parkinson's. It's associated with the entire process of movement, from the planning stages to the initiation and execution of the movement. And this is the most disabling symptom early on in the progression of the disease. So you all may know that approximately 1.5 million Americans have Parkinson's disease, and about 50,000 Parkinson's patients are newly diagnosed each year. There aren't any blood or lab tests to assist in the diagnosis. And physicians instead need to make the diagnosis based on a patient's symptoms or a patient's medical history. There's no cure for Parkinson's, but treatments can involve medications, therapy, surgery occasionally, lifestyle modifications, and support groups. Interestingly enough, though, when we talk about the eyes, patients often have normal or near normal visual acuity, which means that you have the ability to read the bottom row on the 20/20 line of the chart. Yet the patients still complain of difficulty with their vision abnormalities, difficulty reading. So when we talk about how Parkinson's impacts the eyes, I want to go into a little bit more detail about the common symptoms, the causes, and the treatments that are available in a patient with Parkinson's. Difficulty moving the eyes. So a patient with Parkinson's will often experience difficulty in either beginning a movement of the eyes or in an inability to be able to move the eyes quickly. So the smooth movement of the eyes is impaired and the movement is slow and jerky. And a patient may often notice this first when they're watching a quick, fast-moving action, like watching a tennis ball volley from one end of a court to the next. And when we talk about difficulty with movement of the eyes, oftentimes these difficulties may be improved with medication. But we talk about looking up close and what are some things to help a patient who's having difficulty reading and not able to follow the page. And oftentimes using your finger as a clue to help guide your eye across the page can make a difference. Again, Parkinson's patients may not have the best motor control to use their fingers to guide their eyes. So oftentimes just simply using a guide to help the eyes follow the print across the page can be really helpful as far as helping the patient accomplish the reading that they used to be able to do easily. When we talk about difficulty moving the eyes, this really segues well into the prior presentation about driving. And oftentimes it's not just that the eyes have difficulty with movement, but it's difficult coordinating the head and the eye movements together. And this has huge implications for driving. And this is something that really needs to have, you need to seek advice from your optometrist and your physician and your family members as far as deciding what the next best steps should be for you as far as your individual abilities and your ability to maintain your independence too. Double vision is really common. And when we talk about double vision generally means it's an impaired coordination of the muscles that prevents proper alignment of the eyes, and that leads to double vision. So if we think about how the eyes work, typically when we look at something far away, we relax our focusing or our accommodation, and our eyes point pretty much straight ahead. When we're reading something, our eyes need to converge or point in, and we also need to elicit accommodation or focusing in order to be able to do that reading. So oftentimes, double vision is worse at near because the eyes don't have the ability to converge or point in. Bifocals are typically something that a patient who is older needs to help out with their focusing. And this is an aging change. We all lose our focusing ability. And bifocals need to be modified as a patient gets older to help with their focusing ability. But the problem is bifocals oftentimes impact how the eye aligns. And I mentioned earlier how eye alignment and eye focusing are linked, and you really can't do one without the other. So when you look straight ahead, you relax your focusing and your eyes point straight. When you look in toward a near point task, your eyes converge and you also have to elicit your focusing. Conversely, when you go back to looking straight ahead, your eyes diverge and the focusing changes. And you can't do one without the other. So what happens is that the bifocals may help with the visual acuity or the ability to see, but they actually may hinder the ability for the eyes to align. So some patients with Parkinson's actually benefit from 2 separate pairs of glasses so that they're not having the issues with their eye alignment. Again, 2 pairs of glasses aren't necessarily ideal, however, because with 2 pairs of glasses, you always run into the concern of leaving one pair behind, having to search for your other pair, and that's inconvenient too. So again, this is really something that needs to be considered on an individual basis and a case-by-case basis to really help each patient with their symptoms. Prism glasses can also be prescribed to reduce double vision. And Prism is a special lens that's put into the eyeglasses to help with the eye alignment so that the double vision goes away. And again, the Prism glasses can help with the double vision. If the double vision is not consistent or constant, then the Prism glasses may be something that only needs to be worn on a part-time basis. And again, this is something that your optometrist will really be able to help give you guidance for. And this is something that can be tested at your routine eye exam. It's something that you want to bring up to your eye doctor, though, so that they know to do additional testing for it. Now, there are other causes of double vision that can be unrelated to Parkinson's. So if you are continuing to have double vision, again, you want to make sure that your optometrist is examining you, talking about the possible causes, and working with you and your general physician to try and figure out how to minimize the double vision. When you're reading, a really quick and easy way to reduce double vision is to cover one eye. Now, that's not something that's sustainable. It's not something that you want to do on a permanent basis. But if you experience double vision, a quick way to reduce it is reduce the image of one eye, and you'll only see single. And then if the double vision does not go away, again, really make sure you're seeking from your optometrist a more permanent solution for you. Blurred vision. Again, a really common symptom in a patient with Parkinson's. And blurred vision can be due to difficulty moving and aligning the eyes. Just like I spoke earlier, when the eyes don't align, they're not going to focus properly, and one impacts the other. So oftentimes, just by having difficulty with your eye alignment, you'll also induce blurriness to the vision, and one impacts the other. So again, when we talk about blurred vision, patients may experience that too from the medications that are taken with Parkinson's treatment. And what's interesting about this is that blurred vision can occur at any point during the course of the treatment, not necessarily right at the beginning. And again, what's really frustrating for patients is the blurred vision may improve over time on its own. So oftentimes, if you have blurry vision, or if it's persisting or worsening, you obviously want to seek attention from your doctor and your optometrist. But it's something where you may want to take a step back and try and be patient to see if the condition does get better or improve on its own. If you are wearing reading glasses, you may simply need an increase in the prescription to the reading glasses to help with the blurred vision. And again, your optometrist can help you with this. When we talk about medications that are prescribed with Parkinson's disease, some of the medications will actually dilate the eyes slightly. And you know, if you've ever had your eyes dilated, that a side effect of having the pupils dilated is that the up-close vision becomes blurry. So that's another reason why the vision may become blurry with Parkinson's disease and the medications. So again, sometimes changing the medications, modifying the medications can make a big difference. What's interesting about this, though, is that your visual acuity, or the ability to test to be able to see that bottom row on the eye chart, may be normal, even though you're having these symptoms. So sometimes you have to be diligent and really talk to the eye doctor about how your eyes are performing. Because if it's just a simple vision test, read the bottom row, you may do better than expected. But if it's something where you're experiencing these symptoms, you really want to make sure your optometrist delves further during the exam to really see how your eyes are performing together. Dry eyes are the most common ocular complaint in Parkinson's patients. And in fact, 2/3 of patients with Parkinson's experience dry eyes. And we know that the medications used to treat Parkinson's causes dry eyes. So certainly that's something to be aware of. And one of the easy ways to treat dry eye is to simply use artificial tears. Again, these are typically sold over the counter. They're something that you put in, typically on an as-needed basis. But oftentimes, artificial tears are something that you might want to seek some advice from your optometrist as far as what brand or what type may work best for you. Some brands have more oil versus water in the tears, so it may be more beneficial for a patient who doesn't have the right quality of tears. And certainly when we talk about using the artificial tears, oftentimes they do need to be used quite consistently to have the optimal effect. So that's something where you may need to just start that with your everyday routine. Brushing your teeth twice a day, putting the tears in when you first wake up and when you go to bed. When we don't have a good tear film across the surface of the eye and the tear film starts to break up, then as that tear film breaks up, the vision becomes reduced too. So another side effect, besides just having uncomfortable dry eyes, is that the vision fluctuates. So part of the blurry vision or fluctuating vision may indeed be due to dry eyes. And that's another reason why you want to make sure your eye doctor looks at the quality of your tear film and talks to you about maintaining that quality to give you the best possible vision, not just comfort for your eyes. Interestingly enough, when the surface of the eye becomes compromised from dryness, then the eye is more likely to get an eye infection. So conjunctivitis can result. And that's typically treated with antibiotics from your eye doctor. It's something that typically is easily treated, but again, it's something that you need to seek advice from your eye doctor for the best possible care. Occasionally, patients with Parkinson's will have an involuntary closure of their eyelid, and that's called a blepharospasm. It happens when the muscle that closes the eyelid contracts or goes into a spasm, and it's actually rare in patients with Parkinson's. But we can have varying levels of blepharospasm. So occasionally patients will have repeated twitching of their eyelid, difficulty keeping the eyelid open, and sometimes complete closure. And if that happens, obviously that would interfere with vision. When we talk about blepharospasm and having twitching of the eyelids, the cause of blepharospasm is really confusing because occasionally the medications that are used to treat Parkinson's can improve blepharospasm, but on other occasions it's actually been shown to make blepharospasm worse. So again, this is something where you really need to work and be patient with your physician as far as trying to maintain and reduce the blepharospasm, but yet maintain control of your Parkinson's. Occasionally, a patient will get twitching because their eyes are dry and the surface is not normal. So again, treating the ocular surface with just artificial tears may make a difference in some patients with twitching. The other thing that you should know is that if a patient has continued blepharospasm or twitching of the eyelids, occasionally Botox injections can be used to reduce that. If we look at a general population, however, most people that present at an eye doctor's office with twitching of their eyelids simply have the twitching because of stress. And if we talk about a patient group that might have more stress than normal, it would be Parkinson's patients too. So oftentimes it's important to realize that some of your symptoms may be related to Parkinson's because of the disease impacting the muscles, etc. But some of your disease may be from the stress that's induced. And oftentimes just finding things that you can do on a day-to-day basis to decrease your stress may improve some of the twitching of the eyelids and some of these ocular symptoms. Hallucinations are actually something that's quite common in a patient with Parkinson's disease. And they can actually manifest early in the course of the disease and can directly be a result from the disease. And interestingly enough, they can occur in patients who aren't even being medicated for Parkinson's yet. So it's something that needs to be monitored closely and watched closely. It's often seen in patients that are taking certain medications of Parkinson's. So you really want to talk to your physician and seek advice from them as far as what can be done with your medications to reduce the experience of the hallucinations. And the main reason why I want to bring this up is I just want to educate you about the fact that hallucinations are actually more common than you may expect, and they are a side effect of Parkinson's disease. So if you feel like you're experiencing these, you don't want to feel embarrassed or ashamed, and it's something that you should feel comfortable bringing up to your physician and discussing that with them. Contrast sensitivity is typically reduced in a patient with Parkinson's disease. And what that means is that you have a more difficult time seeing a dimmer image in a dimmer environment. So again, during daytime, you'll have higher contrast. Blacks look black, whites look white. At dawn or dusk, when the whole world's kind of gray, it's harder to discern those details. And patients with Parkinson's have a decrease in their ability to perceive those details with reduced contrast. And that's something to be aware of. This really can impact print too. When you're looking at packaging on foods, for instance, it's not always that high contrast black on white. Oftentimes the print is blue on yellow or some unusual color combination that doesn't have that contrast. So you want to be aware that it may be more difficult for you to be able to discern some of the details than it had been in the past. And again, typically these difficulties can be made better with a modification or treatment of the Parkinson's with medications. Color vision is reduced in patients with Parkinson's. We see that Parkinson's disease patients have significantly higher error rates on color vision tests, especially if we compare those to age-matched controls. And the thought process is that there's dopamine that's reduced in the cells of the retina, and that leads to this decreased color vision and decrease in contrast sensitivity. So again, making sure that your Parkinson's is being treated properly can reduce these symptoms. This was discussed at length just a few minutes ago, but patients who have Parkinson's disease will notice a decrease in their visual spatial orientation. So it's more difficult to judge the space around you. You don't have the ability to perceive depth as you used to. Some of this may be because the eyes aren't aligning properly, so the depth perception is reduced. And some of this also may be because the brain isn't able to interpret and process the visual stimuli like it used to be able to. So interestingly enough, this is something where some patients are actually made better or improved with their ability to perceive and orient themselves in space by using some different clues. So some patients will use touch or they'll use proprioceptive clues to help as they're moving through their home and help guide them through the home so they feel like they can actually orient themselves in space more comfortably. Problems with visual spatial orientation really have a huge impact on driving, and that has a huge impact on patients' independence. You know, in today's day and age, patients are spread throughout the country. Patients may not have the family support that we typically think of, and losing that independence with driving has a huge impact as far as your day-to-day life. And I think this is something where you really want to work together to have your doctors collaborate with you, along with your family and friends, to decide what's going to be best for you. So your optometrist will talk to your physician, who talks to the occupational therapist, who has a discussion with you and your family and friends to decide how you're doing with your driving and whether or not you should continue. And this is really important for you to really be championing your doctors to work together to really help you get the best possible outcome. Occupational therapists really can help with some of the advice as far as visual spatial orientation. And oftentimes they can even come to your home and help organize space, look at your daily activities, and help guide you so that you're able to maintain your everyday activities the best as possible. So touching clues. So proprioceptive clues are oftentimes clues that your brain gets from how touch orients yourself in space. So again, if you're having difficulty orienting yourself in space, just doing everyday activities in your home, oftentimes by taking a moment to touch the side of the counters or to touch the wall as you're walking, those clues of touch can help your brain orient itself so that the movement becomes easier. And that's something where the occupational therapist can really give you advice as far as how to maximize your abilities. I wanted to take a moment to discuss glaucoma in Parkinson's disease. And as you may already know, glaucoma is a group of eye conditions that damages the optic nerve, or the cells of the retina as they head back toward the brain. And I want you to know that having Parkinson's does not put you at a greater risk for glaucoma. However, when we talk about medications that are used to treat Parkinson's, that can have an impact on glaucoma. And let me explain why. Normally we have fluid in our eye, and if that fluid builds up to a certain level, the optic nerve can become damaged. And remember, with damage to the optic nerve, that can lead to blind spots. And with time, it can even lead to blindness. And typically, a patient with glaucoma doesn't notice it because their brain fills in those blind spots. But still, it's something that can be examined at your routine exam. Normally, the fluid in the eye flows out of these meshworks. But what we know from earlier is that some of the medications that treat Parkinson's can cause mild eye dilation. And that can cause the iris, or the muscle here, to bunch up, for lack of a better term, into the outflow area of the meshwork and actually prevent the fluid from leaving the eye the way it should. And that can cause pressure spikes, and it'll cause angle closure glaucoma. Now, some patients and some certain patient populations are at a greater risk for getting angle closure glaucoma. And we do know from studies that patients of Asian descent tend to have a narrower angle and are at a greater risk for developing angle closure glaucoma. And I think, again, this education is really important because I think this is something that you do want to talk to your eye doctor about. And make sure your eye doctor is examining your angles to see if you're at risk for angle closure glaucoma. And it's really important to make sure that you educate all your healthcare providers about your general health. Oftentimes, patients will say, do I really need to tell my optometrist I have Parkinson's? And again, it's important to let them know because they're going to watch these structures closely to make sure you're not developing other diseases. Conversely, do I really need to tell my general physician that I'm being looked at for glaucoma from my eye doctor? And you do, because that may change the medications they use to treat you for Parkinson's as far as minimizing your risk for angle closure glaucoma. So if there's no alternative available, then you'll have this discussion with your optometrist, your ophthalmologist, and your physician about the risk of angle closure glaucoma, but yet the benefits of treatment for your Parkinson's. And together, the three of you will decide what's going to be the next best step as far as managing all three parts of those diseases. So looking forward, I think we all know that Parkinson's is progressive. So it's important to get an idea of what are some things I can do to help out with this disease and to influence the course of my own disease. And certainly you want to make sure that you're really taking control of your personal vision care. So if you have difficulties with your eyesight, you want to talk to your physician who may consider modifying your medications. And then once your medications are stable, you want to make sure you're having a thorough exam with your optometrist who can make sure that your visual symptoms are being taken care of and managed appropriately. And again, as I mentioned earlier, it's really important to make sure that your healthcare providers are collaborating with each other to really maximize the benefits that you have and the ability for you to perform your day-to-day, everyday activities without having day-to-day concerns. We all know that optimal vision impacts the general quality of life and all of our activities of daily living. And what can be really frustrating with Parkinson's disease is that there are no cookie-cutter answers. And it's very much a personalized approach to try and discover what might work best for you as far as reducing some of your symptoms or your concerns. When we talk about bifocals, again, instead of bifocals, 2 pairs of glasses might be more beneficial. Yet 2 pairs of glasses are frustrating because you have to keep track of 2 pairs. And you might leave one behind and you have to follow up and find that other pair of glasses. So that can be inconvenient even though it may give you better vision. If a patient has mild amounts of astigmatism simply means that a ray of light is focused as it enters your eye differently than the rest of the rays of light as they enter your eye. So with an astigmatism pair of glasses, the glasses will be corrected to correct for that specific ray of light more so than the others. But in a patient with a patient with Parkinson's, the glasses may not be as stable on their face as someone else. And if the glasses tend to be bumped, moved around a bit, then the astigmatism correction won't be optimal. So occasionally in mild amounts of astigmatism in a patient with Parkinson's, it actually may be beneficial to leave that little bit of prescription out for the patient to have more consistent vision. And again, this is a discussion that you'd have with your optometrist. Also, it's important to take a step back and realize that there are a lot of other factors that may not be related to Parkinson's at all and instead have a different cause, but that also may be impacting your vision. So again, you might have some blurriness. You might be worried it's the medications that are used to treat Parkinson's. But then during an eye exam, you may come to find out that you have a cataract. And a cataract simply means that the lens inside of the eyeball starts to get cloudier as we get older. And as we continue to get older, the cloudiness tends to increase. And at some point, a surgeon will go in, take out the cloudiness of the lens, and put a lens implant in its place. So that oftentimes can give you better vision. And this is something that's just really an aging change that tends to happen. It's not necessarily related to Parkinson's at all. So sometimes, again, you have to be patient with your healthcare providers, really let them work together to tease out what the cause of these visual symptoms might be. Another age-related concern is presbyopia. Again, that's that loss of focusing that happens to us all when we get around age 40 or older, and that does tend to get worse as we get older. So in some instances, if you're having difficulty and even mild double vision with reading, it may be something as simple as just modifying the prescription for the reading glasses. But it could be something more. And again, that's something that might require additional visits with your optometrist to really figure out what the cause is. I work at a refractive surgery center most of the time, and a lot of patients will ask me, should I have LASIK? I have Parkinson's disease. Would LASIK be a good option for me? And I think in many ways, LASIK would be fantastic for a patient with Parkinson's because you have so many other motor concerns that who wants to deal with a pair of glasses? And the thought of being glasses-free is really fantastic. However, there are some concerns. Even the latest technology of LASIK surgery cannot correct the loss of focusing that happens for up close. So LASIK typically only corrects the distance part of our prescription. It cannot correct the up close part of the prescription. So you'd still be wearing reading glasses. And that would be a disadvantage. You'd still be having to deal with glasses. So you're not necessarily gaining that glasses-free vision that you might have considered. We also know LASIK surgery does tend to increase dryness. We talked about how Parkinson's patients have dryness already, typically. So again, LASIK may not be the best option in that it may leave you with dry, uncomfortable eyes and fluctuating vision because of that dryness and that unstable tear film. When we talk about cataract surgery, it may be a better option for patients. It doesn't deal with the surface of the eye, so the risk of dryness is less. And the latest generation of lens implants, when a cataract is being removed and a lens implant's being put in, have amazing ability to not only maintain or correct distance vision, but also give you some focusing ability for up close. So it's a really neat option for patients. And again, typically only done if you have a cataract, but it's something where patients generally are very happy with the results because of the benefits that they gain from the correction. What can you do? And it's always important to realize that you want to stay involved and get involved. And being here at the Parkinson's Institute, you know that the mission of the Institute is to find a cause for Parkinson's, research for a potential cure, and also maintain the best possible care for each patient individually. And the fact that you're all here, you're really trying to work together to accomplish these goals. And I think that's really important to stay involved. You really want to consider participating in individualized advanced research. And clinical research is a way for you to feel like you're making a difference in the course of the disease, not just for yourself, but for future generations, and trying to help the scientists make a difference, hopefully in the progress of treatment of the disease. So when we talk about some of the different clinical studies that are available, there's a Parkinson's Progression Markers Initiative, PPMI. It's a clinical study, and it's trying to identify the genetic biomarkers of Parkinson's disease. And the really unique thing about this study is not only are they looking for patients with Parkinson's, but they're also looking for patients without Parkinson's, without a history of Parkinson's, to act as a control. And this is a way that family members or friends can also be involved to try and help make a difference and feel that they're really working together with you to try and find solutions. We're really lucky here in the Bay Area with the fact that one of the PPMI sites is right here in Sunnyvale at the Parkinsons Institute. So it's a way for all of you to be able to get involved. It's fairly easy to do, it's close to home, and it's a way to try and make a difference and really feel like you're contributing. Another company called 23andMe is actually research that you can participate in from the comfort of your own home. And you may have heard of this before. They're actually trying to collect patients with Parkinson's disease and collect their information. And what happens is they collect a DNA sample, or you spit into a tube, and then you answer surveys online. And they use this information to try and come up with information for Parkinson's disease. And what's really unique about this study is they have a huge patient size, since they're able to collect patients from around the world. It's a really diverse group of patients. The goal is 10,000 patients. Currently, they're at 4,500. And if this is something that you're interested in doing, you can log online, and this does not cost you anything to have this testing done. And afterwards, you'll get information specifically about yourself and some other genetic risk factors and genetic traits that you might find slightly interesting too. But again, this is something that you do online and work together with others to be able to find a solution and be able to find answers. Online, you also have a unique opportunity to connect with other individuals. So it's another way of trying to establish that support group, not just locally, but also online. Again, consider supporting Parkinson's research. So when we talk about being here at the Parkinson's Institute this time of the year, patients are often looking toward charitable donations. Family members are thinking about tax-deductible end-of-the-year giving. And I think this is another way where family and friends can donate money to try and make a difference and to feel that they're trying to work together to make a difference. Taking classes, staying up to date, well-informed with advances with Parkinson's, and just becoming knowledgeable about what to expect with Parkinson's is really helpful. Sharing your experiences with other people, staying connected to support groups for your emotional well-being can really be important when you're dealing with a chronic disease like Parkinson's. We all want to make a difference with Parkinson's disease, so oftentimes these small steps can really influence the course of the disease as a whole. I want to put up some of the references that I found useful as I was coming up with a presentation today. And certainly if any of you want to delve into this information further, I think you have a copy of all the references here today. And I want you to all feel free to contact me via email if you have any questions about anything that we've discussed, but I'll open it up to questions in a moment. And I really wanted to take a moment to let you know that I hope you've found this talk to be enabling, in that you feel a little bit more informed about what to expect with your vision and some of the options that you have with your eye care, and also empowering in the fact that we are living in an environment where we're in the age of new technology that allows us all to individually influence possible breakthroughs for the future. So thank you very much for this opportunity, and I'm going to open it up to questions. And his question was, how do you find an eye doctor that has experience in treating a patient with Parkinson's? And what's really interesting, and I think even the fellow optometrists that are in the audience today, nothing that we discussed is really that unusual. And I think what's really key in trying to treat a patient with Parkinson's and maximize your vision is to find an optometrist that will take the time. Because I think what often is required in a patient with Parkinson's is not any special fancy testing or special fancy glasses typically, but someone who's really willing to work with you to try and find a solution that works for you, and then also someone that's willing to invest in possible changes and open to concerns. And that can be very difficult. And I think the best way really in finding an optometrist is word of mouth. If you have a family member or a friend that's just thrilled with their optometrist, then I would encourage you to see them. And let them know ahead of time that you have Parkinson's. And I think there's nothing wrong with letting them know that because you have Parkinson's, you may want a little bit more time during your eye exam. You may want them to allow you to have, instead of a half-hour eye exam, a full hour for your eye exam. Or maybe even an hour, 15 minutes, so that you can ask and have questions answered. And I think an eye doctor is going to be wanting to do this for you to maximize your vision, but then also to make sure that you have exactly what you need for your day-to-day activities. I hope that helps. Is it typical for Parkinson's patients to have their prescription numbers go up? Maybe. You know, what's really difficult is that I think there is no typical for Parkinson's patients. So some Parkinson's patients may have a shift to their prescription. And it's true, and also it depends on your age and how you're eliciting your accommodation or you're focusing. So if you're over-focusing or over-accommodating, you may take more prescription compared to years past. Oftentimes, though, as we age, we lose our ability to accommodate our focus. So oftentimes our vision improves as we get older. And then to really throw a wrench in it, well, if you're starting to develop a cataract or other health issues, that can really impact your vision too. So it may be really hard. And as I mentioned, sometimes it's hard to tease out what the cause of some of these changes are. And that's where I think it's really important, not just for your eye doctor to be open to trying to search for those, but also for you to be patient so that together you can come up with the best solution for you. Is there an actual test to see if a patient has issues with depth perception issues? So yes, depth perception is typically tested during an eye exam. It's typically tested at near. So again, typically it's not tested for far away. So it doesn't always translate to problems with depth perception with driving. But yes, depth perception is tested, and typically in a new patient in an optometric office, depth perception should be tested every time. Now, it normally wouldn't change for most people. So if you've been a patient at an eye doctor's office for 20 years, they may not pull out their depth perception test. But again, that's a reason where you'd want to let them know, I've been newly diagnosed with Parkinson's, or I don't know if you remembered, but I have Parkinson's, and I'm having some concerns with double vision, or I'm not sure if my depth perception is as good as it was. Can you test this? Can you let me know how I'm doing? And then again, working with you to try and figure out what kind of glasses will maximize your vision. It's called a stereopsis test. Again, I know it doesn't really matter, but that's the name of the test that tests depth perception. What she's mentioning is her blood sugar has been a little bit out of normal. You may have diabetes, and that may indicate that the prescription's fluctuating, and that's actually very common. If a patient is having fluctuations in their blood sugar, then the vision will fluctuate. The amount of sugar in the lens can cause the vision to become wacky, and a lot of patients will say, what am I supposed to do though? It's not stable yet, we're working with medications, there's other things, what do I do in the interim? And that's where, you know, I think you have the right to really have that conversation with your ophthalmologist and say, look, I know I'd be spending money on a pair of glasses that may actually be temporary, but I'm willing to take these to someplace that's maybe less expensive, get a cheapy pair of eyeglasses, just so that I've got better vision right now. And there's no reason why they should deny you that prescription. Pardon? If you pay, exactly. I mean, you're paying for the examination and you're paying for the glasses. Now, I think it's their duty to let you know if your blood sugar's not stable that, hey, this prescription may not be stable and it's in your best interest to wait. But if you don't feel like you can wait because the shifts have been too dramatic, then, you know, certainly there's nothing wrong with getting glasses as long as you understand that the glasses might be short-lived based on your blood sugar stability.